Today, we are going to be talking about what it means to be a preceptor and how you can be the best possible preceptor to your students. First, I want you to think back about your experience as a nurse practitioner student. Use those experiences to try and emulate who you want to be as a preceptor. In this video, we are going to review what it means to have imposter syndrome and how you can overcome it as a preceptor. We have all had imposter syndrome at one point in our nursing careers. The uncertain feelings of inadequacy and being unprepared can affect our confidence in our abilities as nurse practitioners. It's important to first acknowledge that these feelings are normal, valid, and more common than you think. Imposter syndrome is defined as a psychological event in which an individual doubts their talents, abilities, skills, or accomplishments. Imposter syndrome can prevent nurse practitioners from committing to preceptor roles despite being knowledgeable in their specialty. I want you to take a moment and recall just how little you knew when you first began your nursing education. Now fast forward to where you are today and really reflect on the expansive knowledge you've acquired in that time frame. Here are some ways to tackle imposter syndrome and move forward with confidence in precepting. First, you need to take a moment to remind yourself of your educational accomplishments and certifications. You worked really hard, studied hard, and gave your time to those accomplishments. Acknowledge the work that you put in. Next, I want you to imagine that your closest friend or family member is experiencing these feelings of diminished value. Now, what would you say to them? Use this narrative and internalize it towards your own doubts. Third, do you find yourself brushing off compliments or minimizing your successes? Don't. You should celebrate your wins no matter how big or small. Did you receive an award? Celebrate. Patient called to thank you for your exceptional bedside manner. Wonderful. Celebrate it. These are reminders that the work that you do is meaningful and valued. Perfectionism is something we know is impossible to achieve, but nevertheless strive for as healthcare providers. Now, I'm definitely guilty of this one, but I've learned that we all experience failures at some point in our careers. It's these failures that help us grow and ultimately learn to become better nurse practitioners. Know that being a great nurse practitioner does not mean being perfect. Finally, recognizing feelings of imposter syndrome and taming them throughout your career will ultimately help you become the provider your patient needs and the preceptor your student needs. In order to have successful learning take place, the groundwork needs to be set for a proper learning environment. This starts with something as simple as introductions. Once you have been connected with a student, reach out and introduce yourself. The student is likely to be way more anxious than you are about precepting. Be sure to share your enthusiasm for having them in your practice. Just as you would want a student to be enthusiastic and interested in what you are teaching them, the same goes for a preceptor who is excited about delivering the content. Introductions can be done by email, text, or phone and should include the following: your name, your practice location, the best way to reach you, your work schedule, student attire, parking details, and the items the student should bring with them, like their NPHub specialty notebook, stethoscope, pen, and laptop. I highly recommend planning out clinical days in advance. For instance, if a student needs 125 hours of clinical experience in your practice, planning out when and for how long the student will be present not only sets a professional tone for the rotation, but it also promotes organization and accountability for both parties involved. Take into account any university paperwork that needs to be completed, as well as midterm and final clinical evaluations. These evaluations are usually done over the phone or in person by the university instructor and involve feedback regarding the student's performance and clinical skills. Now that we've set the foundation for introductions, it's time for your first day of clinical precepting. It's like first date jitters, but I promise it's less tortuous. When your student arrives, provide a welcoming introduction and give them a tour of the practice. You will also want to introduce them to any other providers and clinical staff in the practice. You'll want to review a typical schedule with your student in order to prepare them for the day ahead. For example, from 9 a.m. to 12 p.m. we see patients in the office, from 12 to 1 is lunch, 1 to 3 is telehealth consultations, and 3 to 5 is administrative tasks and charting as needed. Finally, ensure that you act as a role model to the student. You want your student to arrive on time, dressed appropriately, and with the proper tools to tackle the day, right? Hold your student accountable by being the role model that does all of these things and more. Beginning a clinical rotation with a new student can be nerve-wracking, but by laying the right foundation, you can ensure a successful learning experience. In this lesson, we are going to cover communication techniques and how to tailor your teaching to meet your students' needs. You want to begin with setting expectations with your student. You may be matched with someone that has zero clinical experience in your specialty, Or you may be matched with someone who knows a significant amount. Either way, the only way for you to know the student's strengths and weaknesses is to ask. Have a discussion that includes the following: the student's past clinical experience in the school or employment setting, the student's clinical goals, their professional objectives, and their preferred learning style. For instance, is the student a visual or an auditory learner? Do they prefer observation for a certain period of time before becoming more hands-on? Knowing this will not only save you time in teaching, but will actually ensure that what you teach is processed by your student. Keep in mind that your student may be more anxious than normal. Sharing your professional journey to becoming a nurse practitioner can not only inspire your student, but make you more personable as well. You can even divulge what your professional aspirations and career objectives are too. Use open communication with your student and encourage him or her to do so as well. Remember, effective learning cannot take place under a state of anxiety or under a hostile work environment. Now that you've identified what your student's strengths and weaknesses are, it's time to tailor your teaching to maximize learning. Teaching should provide the knowledge base while igniting critical thinking. Critical thinking is defined as the analysis of pertinent facts, evidence, and observations to form a decision or diagnosis. Think about how many times per day you use critical thinking to provide patient care. It's probably a lot. It really is an essential tool in a nurse practitioner's skill set. You may be wondering how you can facilitate critical thinking in your students. When treating a patient, you'll want to encourage your student to think ahead for alternative patient outcomes. You'll want them to learn how to think on their feet and in the moment, such as during a procedure. Reflection on how things went well or maybe not so well is also key in learning and growing. As preceptors, we are constantly asking our students questions to ascertain whether or not they are grasping a given concept. But did you know that the type of questions you ask are also key to promoting critical thinking? Asking open-ended why questions can elicit more detailed responses and really help the student absorb the knowledge that you are trying to convey. Why questions promote a deeper discussion as opposed to yes/no questions. You can also visually track the student's progress by completing necessary university documents like competency checklists and clinical hour logs. Now that you've mastered your teaching technique, let's head to the next lesson where you can utilize a stepwise approach that will have your student going from dependent to independent. As a preceptor, your goal should be to prepare your student to go from a role of dependency to that of independence. It won't be easy, and in many cases the student will be hesitant, but it is a very necessary transition in order to prepare your student for the role of nurse practitioner. Believe me, they will thank you later. In this lesson, we are going to review a stepwise approach that has you, as the preceptor, gradually taking on a more observational role as the student becomes more independent. Keep in mind that it may take each student a different amount of time to progress from one role to the next. A student advances to the next role when they can successfully complete the tasks associated with each role. The student's first role in clinical rotation is the observational role. In this role, the student observes you perform the complete patient visit. The student has fulfilled this role when they can do the following: identify the patient's chief complaint, recognize the purpose of the visit, professionally interact with the patient, and identify how to obtain a pertinent history. The next role is the semi-independent role, where the student performs the history and observes the physical exam. The student has fulfilled this role when the student can obtain the complete patient history, present the chief complaint and history to you, identify what should take place in the physical exam, and identify potential tests to order. The last and final role is the independent role, in which the student performs the history and presents it to you. You then observe the student perform the physical exam. In this role, the student is able to obtain the patient's history of present illness, perform the physical exam under direct supervision, identify differential diagnoses, and formulate a plan of care. Every preceptor is different in their approach, but this is a general approach you may want to consider. Keep in mind that in every role you remain ultimately responsible for the patient's care and treatment plan. Utilizing the stepwise approach not only builds the student's knowledge base, but it also increases confidence as you expand responsibility with each advancement in roles. As children, we were all taught to share with others. Well, teaching embraces that notion of sharing is caring. If you recall, I recommended that you introduce your student to your colleagues and medical staff in an earlier lesson. Well, the reason being is that your colleagues may come across opportunities that you may not have on your schedule on the day a student is present. For instance, When my student is on site for a clinical rotation, I always encourage the physician to come to me with any learning opportunities for my student. And I will even review their schedule myself so that my student can fill their day with various types of patient encounters. Students absolutely love this and are always appreciative of the effort I put into making their clinical experience diverse. As nurse practitioners, we all know that our medical staff is the backbone of our office. They can be the face of our office and the ones that get things done behind the scenes. With that being said, it can be a really valuable learning experience to have staff teach your student the logistics of running or working in an office setting. These tools are not directly related to traditional nurse practitioner education, but are otherwise crucial to a functioning medical practice. For example, your staff can provide insight on insurance and billing, coding, phlebotomy, and procedure preparation and setup. You may also consider reviewing the 5 rights of delegation as introduced in nursing school with your student. The 5 rights are right task, right circumstances, right person, right communication, and right supervision. Remember, as the nurse practitioner, you are ultimately responsible for any shared delegated tasks. Long, drawn-out explanations do little in teaching a student. It's imperative that teaching is kept short and to the point to really maximize how much material is being retained by the student. Teaching should be done in small, digestible amounts, and only one topic should be discussed at a time in order to avoid overwhelming the student. As healthcare providers, we have all heard of evidence-based practice throughout our entire careers. But you may be asking, what exactly is it and how does this relate to me precepting a student? Evidence-based practice is the problem-solving and decision-making approach that uses up-to-date research to plan and implement patient care. What you teach and how you teach should really reflect evidence-based practice, as it has shown to have many benefits. For instance, it results in improved patient outcomes, reduces the need for unnecessary treatment, decreases complications, and expands the skill level of the practitioner. Remember, just because we've always done it this certain way doesn't mean it's evidence-based. Healthcare and medicine are constantly evolving, and it's so important to stay up to date with these changes when you are in a teaching position. I am really excited about this lesson because I think as preceptors, we are sometimes hesitant to put too much on our students' plates, when in actuality, assigning responsibility is one of the keys to growth and learning. There are so many ways to have your students take responsibility while in clinical rotation. Think of a topic related to your specialty that you would like to know more about personally, or maybe a set of guidelines that you know have recently been changed. Perhaps a new treatment option for a common problem seen in your practice. Have your student research it and present it to you on the next clinical day. Showing your student that learning is continuous and doing it together can really strengthen the preceptor-student relationship. Another way to assign responsibility and maximize any potential office downtime is to have the student update the patient education forms related to a diagnosis seen earlier that day. For instance, a patient handout on the recommended diabetic diet, or how to monitor for signs of worsening hypertension. The interested and inquisitive student will have plenty of questions during their clinical rotation. Consider holding back on answering all of them and instead have your student research the answer and report back to you for further discussion. Many preceptors may feel as though their students have limited activities when not in direct patient care. Take the administrative tasks we are responsible for, like reviewing lab and imaging results. Have the student call the patient to review these results with them and remain present with any questions the student may have. Nothing truly feels full circle like reviewing results of a patient you saw together the week prior. Finally, consider having your student present a patient case. Sometimes we come across a case that requires consultation with a supervising physician or a colleague. Use this opportunity to have your student present the case to them with you. I have found that presenting a patient case is one of the biggest hurdles students have to overcome in a clinical rotation. And after all, practice makes perfect. Precepting doesn't have to be a chore and more work on an already full plate. Assigning responsibility can enhance student learning while encouraging movement from dependence to independence. In our final lesson, we are going to discuss how to give appropriate feedback in order to help your students succeed in clinical practice. I want you to think back on your experiences as a student. It is very likely that you can recall at least one instance of negative feedback that did little to enhance your clinical knowledge, and it probably impacted your confidence as an RN or a nurse practitioner. Remember, feedback is forever. Think of it this way. How would you want an experienced provider to teach your younger, inexperienced self? Here are some tips for constructive feedback. Always be constructive and continuous in your feedback. Constructive criticism fosters critical thinking. Feedback has a time and place and may be given at different times depending on the situation and learning style of the student. So what exactly is the difference between positive and negative feedback? Well, positive feedback involves criticism of unsatisfactory behavior or performance with guidance on how to improve. Negative feedback is criticism without the guidance. An example of positive feedback would be, I observed that you identified the correct differential diagnoses, but did not apply the appropriate treatment. In this case, you could consider XYZ. An example of a nurse practitioner using negative feedback would be something like, you always forget to ask the pertinent questions. The right way is usually how I do it using XYZ. You can see how each of these would have very different results. Other attributes of positive feedback include being direct and specific by focusing on behavior and not personality. This can sometimes be difficult, right? I mean, you don't vibe with all of your patients, and the same goes for students. This does not mean that a professional relationship cannot be maintained. Personality traits should be off limits in regards to feedback. Positive feedback also builds critical thinking skills and should always be performed in private and never in front of a patient, family, or staff, unless it impacts patient safety in the moment. Feedback doesn't always have to highlight the things that went wrong. Be sure to actively seek out the positive aspects of the clinical day and praise the student, and always allow the student to respond to your feedback. Sometimes providing positive feedback as a preceptor can be difficult, and sometimes it has to be learned. Either way, it can only improve the clinical experience for both you and your student. That's it, guys. I'm so happy you were able to join me today, and I hope you were able to really process this critical information. Remember, we have all been where you are at some point in time. Don't lose sight of your goals, and you will succeed. Don't forget to check out NPHub.com to get access to all of our specialty notebooks. Reviewing these notebooks before and during your rotation will help you lay the foundation for a rewarding learning experience, and maybe even a potential job offer down the road. Good luck.